All right, so for this lecture, we're going to take a little bit of a look at the disorders of the nervous system. So let's go ahead and kind of jump into this. Got kind of a collection, a little bit of some of these disorders. Let me try to move some of this stuff out of our way here. One of the first ones we see is just a concussion. It used to be just kind of what we referred to as a slight brain injury. Usually did not cause any permanent damage, but what we're finding out now is that it really does lead to some long-lasting effects afterwards. One of the biggest ones is the fact that it does lead to CTE, or what's called chronic traumatic encephalitis, encephalopathy. It's this kind of degrading or changes in the brain, and we'll take a little bit of a look at that here towards the end. One of the other ones we see is a contusion, which sometimes is associated with a concussion. With contusions, we see obviously nervous tissue destruction. All right, and then nervous tissue does not regenerate. Right, that's the biggest thing we have to kind of remember here. We are finding out that some nervous tissue will regenerate itself, but it takes an awful long time. Whereas like muscle and bones and other things like that usually take 4 to 6 weeks. Nervous tissue could take 4 to 6 years or longer, is what we find out. One of the other ones we see then is cerebral edema, and I've talked about this one a couple different times. So this is simply the swelling response or kind of inflammatory response that happens with some sort of damage to tissue. And the reason why this one causes such problems is because, again, the brain is inside of the skull and it's got nowhere to go. So as it expands, it starts to compress and start to kill some of that other brain tissue. If it's pressing on the brain stem, it's going to then cause some of the associated problems that we see with those. So problems breathing, consciousness, vomiting, and so on, because all of those are kind of housed right there in the lower portions of the brain. Okay, I want to take a little bit of a look at this video, but I want to look at it together with the CTE. So I'm going to kind of wait here towards the end, and I'll pull this video up so we can kind of take a little bit of a look at it. The other things we see are cerebral vascular accidents, so what we call CVAs. All right, these are more commonly referred to simply as a stroke. So this is a rupture of a blood vessel, usually supplying a specific region of the brain. When that happens, the tissue then that's supposed to be supplied with oxygen, the source dies. Okay, so brain tissue is dying, and that's mostly because it's not getting the oxygen that it needs. Loss of some of the functions. So people that with a stroke, depending on the extent of the stroke and the length of the stroke, obviously we can lose some functions. A lot of times you'll see drooping of the one side of the face or the other, inability to speak, or if it's massive enough, we could end up with a person that's going to have death because of that. Okay. So this is kind of what we see here. So you can see a picture on the left is obviously the lady's had the stroke. The picture on the right is what she normally looks like. And you can see she's got a huge deficit here. Here on this side of her face, because she's trying to smile and is unable to. So you can see it's involved not only that part of her face, but her eye as well. So you can see some huge deficits here, and you can see some of the arrangements here. We noticed and we remember that as we move down parts of the brain, there's different areas affected. So this one really is affecting kind of this lower portion of the brain here off to the side, because that's the one that specifically kind of innervates those facial nerves and innervates kind of that portion. So she's getting a huge kind of issue here because we can see we've got an all-over effect here of the brain. Another one that we see is Alzheimer's. All right, so Alzheimer's is kind of this progressive degenerative brain disease. We mostly only see it in elderly, but we can see there are some people that can end up with Alzheimer's here kind of in middle age. Really what's going on is we have some huge structural changes, and what happens is we get these kind of protein deposits in the brain which cause issues with the fibers within the neurons. Usually victims here will kind of experience a couple different things. So one of the biggest ones is memory loss. And because of that memory loss, they'll usually have some irritability, confusion, and then ultimately they'll start to have some hallucinations as well as death because of the deposits of protein here in the brain. Other ones on top of that one then are Parkinson's disease. I think that's supposed to be of. So Parkinson's disease happens because of a degeneration of these dopamine releasing neurons. And when that happens, we usually see people that have issues with both movement as well as tremors. So they kind of shake as they move, or they kind of shake as they just kind of do normal day activities. Two of the biggest people that we see that have had that are Muhammad Ali, as well as Michael J. Fox. They both had are pretty well known. Obviously, Muhammad Ali passed away a few years ago. Michael J. Fox is actually still working. He just did He did the series. He was just involved in the series, the Designated Survivor on Netflix. If you want to see kind of the result of what happens there, he still shows some huge issues there with Parkinson's. Other ones that we see then are just kind of the what's called orthostatic hypertension. All right, so this is changes in blood pressure simply during rapid changes in body position. So from going from a seated position to a standing position, people will tend to get dizzy. And this really is because they have a diminished effect of the sympathetic nervous system. All right. So remember that smaller portion of the brain, the sympathetic nervous system, takes care of blood pressure for us. And when people change position, we usually see that. A lot of times this happens in elderly people, but it can happen. Can happen in all sorts of individuals, just depending on what we have there. Okay. All right. These are two articles that kind of talk a little bit about CTE, but I want to take a little bit of a look at the one video. So give me 1 second here and I'll get it pulled up. Get the volume turned up here for you.
A new study at Cincinnati Children's shows promising results for protecting athletes from brain injuries, and the inspiration came from an unexpected source.
Dr. David Smith looked at the ideas of a woodpecker and says, well, how does a woodpecker protect its brain?
Woodpeckers have a long tongue that wraps around the head and lassos their jugular vein, which increases blood volume, creating a natural bubble wrap to keep the brain from what's called sloshing.
Brain slosh is the concept of the brain moving inside the skull. So as we see the head and move and an impact hits the head, we know that the brain can also move. The brain is floating in fluids. And what the theory is, if you have less fluid in the intracranial space, there's more room for that brain to move, and there's more resultant damage.
Researchers took the woodpecker theory and applied it to humans by working with a company called Q30 Innovations that developed a collar for athletes to wear around the neck.
You slide it around your neck, and what it's going to do is provide a gentle pressure on the jugular vein. And what that is doing is slowing the blood flow out of my brain, and my carotid continues to push it up at the same rate with every heartbeat. And that little kink in the hose will immediately create a backfill, and it creates an artificial airbag for my brain inside my skull.
After seeing success with the collar in a small study involving high school hockey players, researchers moved on to a larger study involving football players at St. Xavier and Moeller High Schools in Cincinnati.
If we can make this game better and we can make this game safer, why wouldn't we be a part of that?
21 football players on St. Xavier's High School wore the collar during a competitive season. They were tested before play to make sure the lightweight collar fit properly.
It's kind of like a necktie. Once it's on, you kind of feel it, but after 10 minutes, it's just another, like nothing's there.
Football players from Moeller did not wear the collar. All of the athletes' helmets were outfitted with an accelerometer, a computer chip, which tracked every hit sustained during the pre- and post-season. Researchers used advanced MRI techniques to determine the effectiveness of the collar in preventing structural changes to the brain following a season of head impacts.
What we're looking at is white matter structure alterations in response to head impacts. And what white matter is the structural component of the brain, or the axon superhighways of what we look at for how the brain functions. We saw that in this study, the collar group, the athletes that actually wore the collar, they had reduced or no change in their white matter changes. Where the group, the athletes that didn't wear the collar, they saw changes in their white matter structure. This data indicates that this is an area where we need to move forward and do more studies.
All right, so it just gives you kind of an idea of some of the techniques that are out there, kind of like currently researching to try to kind of prevent this from happening. So I'll post that video as well as post the links to the couple things from the Aaron Hernandez kind of ordeal there.